Hello, my name is Nkechinyere Aranesi, and I'm a doctoral student at Frontier Nursing University. I am presenting a public service announcement about cultural humility. First of all, I will start with an introduction, a background, and then I'll talk about application of cultural humility to organizational leadership and clinical leadership. Then I will end with a reference page. All right, I'm gonna share my PowerPoint with you so you can really get a look at what I'm presenting. All right, so we'll start with the first one, application to organizational. Oh no, that's not the first one. So the first page is the introduction page. Okay, um, so this PSA is targeted towards nurse practitioners. And because we're leaders in healthcare and we will come across people from diverse cultural backgrounds. So cultural humility is a process of self-reflection and uh, attitudes towards individuals of other cultures. It pushes us to challenge our own cultural biases and approach learning about other cultures as a lifelong goal and process. Okay, so why is this important? It is important because our country, the United States of America, is a racially and ethnically diverse nation. And practicing cultural humility is valuable because, especially in healthcare, because we get to see these patients every day. We get to see these diverse patients every single day. As nurse practitioners, being culturally humble will help foster trusting relationships with our patients. Also, it will make them feel safe to come to us for their healthcare needs. I'm going to move on to the second slide, which is the background. Okay. So we'll talk about cultural competency versus cultural humility. And I like this picture here because it says that cultural humility is a 24/7 process. So that means it's a never-ending process. It just keeps going and going. So cultural humility was actually established due to limitations of cultural competence. According to Tabalon and Murray Garcia, 1998, cultural humility was established due to limitations of cultural competence, like I said. Just because we are competent about different cultures does not mean that it can be generalized to an entire population. Cultural humility, on the other hand, encourages an active participation in order to learn about a person's culture and personal experiences. Cultural humility in its name implies that one has to be humble to others' culture and experiences. To practice cultural humility is to be willing to relinquish what you think you know about an individual based on generalization about their culture. Instead, get a deeper understanding of someone's culture from being open to what the person tells you and about their personal experiences of their culture and heritage. There are three factors that nurse practitioners should use to guide them towards cultural humility. Okay. Number one of those factors is having a lifelong commitment to self-evaluation and self-critique. Okay, so what does this mean? It means that it means that cultural humility is a never-ending process, like I said, and we have to be able to be flexible and humble when interacting with patients. Number two, being able to fix power imbalances. Remember that you as a nurse practitioner holds power in scientific knowledge, while the patient holds power in his or her own personal history and preferences. Therefore, you have to make sure that you do not tip this balance, okay? So number three is developing partnership with people and groups who advocate for others. When I mean others, I mean other cultural backgrounds and stuff. So as a nurse practitioner, we can advocate for patients, families, and communities in a systematic way. This may involve getting your organization involved in improving patient care and experience. Okay, that's what we can do. All right, I'm going to move on to the next slide, which is applying cultural humility to organizational leadership. Okay, so example of how nurse practitioners can deal with cultural humility in healthcare. So instead of assuming your Mexican patient must be Catholic because of what you learned in nursing school, it will be best to sit down with the patient and talk to him or her to identify their lived experience and personal beliefs about their culture. Okay? You can be culturally competent, but without cultural humility, you can run into trouble of assuming the wrong thing about a patient's culture and ultimately pissing them off and losing them as a patient. Okay? As nurse practitioners, we have an obligation to advocate and empower patients and their families during the most vulnerable times of their lives. In order to do this effectively, we ought to be willing to sit down and listen to them. Also, we need to be aware of our own implicit biases and leave it behind before you go inside the patient's room. Okay? All right, we're going to move on to the fourth slide, which is applying cultural humility to clinical leadership. Okay. Um, so I just like this picture here where it talks about, okay, let me say let me read from the slide. It says, "You're Japanese, question mark. You must love sushi." So the better way to say it, to be culturally humble, would be, "You're Japanese, question mark. How do you feel about sushi?" So this would be a much better discussion versus assuming that somebody from Japanese culture must like sushi. Okay. All right. So I'm gonna move on to the next slide. Okay. So the last couple of slides talk about famous people who exemplify cultural humility. And one of the first thoughts out of my head was Mother Teresa. I feel like from reading her bio, she left her country at a very young age. She was still a teenager, and she moved to India. And while moving there, that's where she was able to get to know these people. She got to know their culture. She didn't, if she wasn't culturally humble, she wouldn't have the name of Mother Teresa right now. And I just like to read off some of the things in her humility list. So number one says to speak as little as possible about yourself. And number two is to keep busy with your own affairs, not those of others. Number three is to avoid curiosity. Number four, do not interfere in the affairs of others. Number five, accept small irritations with good humor. Number six, do not dwell on the faults of others. Number seven, accept censures, even if unmerited. Number eight, give in to the will of others. Number nine, accept insults and injuries. That's a good one. Number 10, accept contempt, being forgotten and disregarded. 11, be courteous and delicate even when provoked. 12, do not seek to be admired or loved. Number 13, do not protect yourself behind your own dignity. Number 14, give in discussion even when you are right. That's a very good one, especially for cultural humility. And then number 15, choose always the more difficult task. Okay, that's about Mother Teresa. So we're gonna move on to the next person who I also think is great, who actually very much exemplifies cultural humility. Is Martin Luther King Jr. And the quote here says, life's most persistent and urgent question is, what are you doing for others? So this talks about servant leadership, but also, for you to be able to do things for others, you have to be humble. You have to actually get to know the person. Good to, you can't just be competent. You have to be culturally humble in order to get to, serve others and do stuff for others too. So moving on, this is the last page. This is a reference page. These are my references. If you have any questions or comments, leave it below and I will answer it here in a little bit. Thank you so much for listening, and I appreciate it all. Okay, that's the end of my video. I hope you liked it. I love the topic, the cultural humility. I felt like it spoke more to me. That's really why I chose it. I just, I knew I was going to have a lot of talking points with cultural humility. If you have any questions, like I said, just leave it below and I'll answer it. Thank you very much.